Across Kenya, more than 7 in 10 households still depend on firewood and charcoal to cook their daily meals. Yet the price they pay extends far beyond the cost of fuel. It is extracted in damaged lungs, in shortened lives, and in futures that never get the chance to unfold.
Being a medic, I can directly connect this to many poor health outcomes, especially for children, the pediatrics group, who suffer from various problems like chronic bronchitis. They suffer from chronic severe pneumonia, and pneumonia is the leading cause of child mortality and morbidity in the county.
The toll on human health is staggering, but what is less spoken of is a financial hemorrhage, felt even by the very institution built to heal the sick.
For example, the hospital where I've worked and I'm currently the chair of the board, we spend a quite amount of money in terms of fuel for cooking for over 200 patients, where we spend between 300,000 to 400,000 in terms of the amount of money spent for cooking. Now, if we take case example of that hospital alone and translate it to the many level 4 hospitals we have in the county, it means there is a lot of production of non-clean energy in our sectors.
And the damage does not stop at the hospital gates. It reaches into the forest, the air, and the climates we all share.
To supply this firewood, of course, we are cutting trees, and this is affecting our climate. It is affecting the environment in a serious manner. We are having drying of rivers, and the water sources have diminished, and this will cause the spiral effect to our healthcare system.
Rising to meet this crisis is a UK-funded consortium of 3 organizations united across 3 Kenyan counties by a single urgent ambition: to accelerate the nation's transition to clean cooking.
The program is to support the ministry to achieve its objectives and its goals, to ensure that we have transitioned or achieved modern and clean cooking for all by 2030. So specific objective to this is that first we are working in 3 counties. We are working in Meru County, we are working in Taita Taveta County, and also Kakamega County. The national goal cannot be achieved without achieving it at the county. So we have to start at the county as we move towards contributing to the national goal.
Sound policy is only ever as strong as the evidence beneath it. And credible evidence must be built with every voice accounted for. It is GAMO's East Africa that is laying this critical foundation.
Why a standardized framework is because it will help the county planners to identify who benefits from clean cooking solutions, where the gaps are, and what services and how they affect the diverse groups within the county.
Yet numbers alone cannot tell the whole story. Behind every data point lies a lived reality. A woman, a child, a household navigating impossible choices.
Ensuring the frameworks, data collection tools and the frameworks have gender equality, disability and social inclusion considerations by ensuring that the data fields are disaggregated by age, sex, disability, inclusion and location. This ensures that we capture all the opinions and the lived realities within the 3 counties and incorporate that into the policy.
Gathering that kind of evidence demands more than sophisticated tools. It demands people of integrity, trained to ask right questions with care and without bias.
We facilitated hands-on training for enumerators who are going to help us collect the data. We trained them on gender-responsive interviewing, ethical data handling, ensuring that they can identify JETSI indicators and entry points.
And when the data is finally in hand, the work is only just beginning.
We'll also use the findings to ensure that the county has monitoring ability to ensure that once the project ends, they can still be able to track what's happening within the county in terms of clean cooking and within the sector.
Policy opens doors, but it cannot walk through them alone. The artisans, suppliers, and entrepreneurs who build, sell, and install clean cooking solutions must be equipped to lead the way. The task falls to CCAK.
We were able to go out and meet different clean cooking solution artisans, suppliers, and we engage them, both biogas technicians, ICS producers, people who are in EPC or electric cooking supply chain. So we had a tool that we administered to the entrepreneurs just to get to understand the business profiles, how they conduct their businesses, what are the real business needs, what are the real technology needs, gender, financial needs.
Their training runs deep, not merely imparting skills, but instilling standards that will outlast the project itself.
Like, for example, if you're talking about biogas technicians, most of the biogas technicians in this county were trained on doing the fixed dome and also the floating drum technologies. But we want to see how we can capacity build them further. We upskill them so that they're able to handle other biogas technologies like the prefabricated biogas systems, so that they become holistic in terms of solution provision, so that whoever wants prefabricated biogas system or a floating drum, then they're able to offer varieties. For the well-established artisans who are producing high-quality products, we want to introduce them to issues of clean cooking standards. Already we have about 17 standards that have been developed for clean cooking solutions, which CCK was part of when they worked with Kenya Bureau of Standards to be able to come up with this solution, with these standards. So we'll be exposing them to the clean cooking standards so that they're able to become competitive in the clean cooking markets, just to ensure that the products that they take to the market are of high quality and they can fetch high prices.
Yet, even as markets are built and supply chains strengthened, Dr. Kubai issues a powerful reminder. The true measure of this work is not market readiness. It is whether a child breathes easier tonight.
Lack of clean cooking is causing what we call indoor pollution. Indoor house pollution is a serious cause of and the exacerbation of chronic conditions like asthma. If you expose somebody to that smoke, it reduces even their lifespan and many other things.
When the project draws to a close in December 2026, the momentum it has generated must not close with it. From the very beginning, sustainability has been woven into the fabric of every intervention.
We made a deliberate effort of ensuring that we have a training program for TOTs. We want to capacity build the TOTs so that they are able to support the county government of Meru, Taita Taveta, and also Kakamega to be able to deliver technology trainings, business skills trainings beyond the project deadlines. We are the voice of the sector. We are the voice of the clean cooking sector. We champion clean cooking. And so one of the things that we'll be able to do is to make continuous follow-up with the county government of Meru, especially on the implementation of the clean cooking policy. Because this is a very critical document that the country needs. It's not only important for the Meru people, but it's also important for us as CCK, who are the sector champions on clean cooking.
For Miriam, lasting change means something very specific. Clean cooking secured not as a donor-funded initiative, but as a permanent priority in county budgets long after the last report is filed.
We are also very intentional to see that we are doing capacity building. One of the gaps that we realized also is that at the county level, not so many people are aware about clean cooking, because many people interpret energy to electricity. So we are also trying to demystify the aspect what energy exactly is, and not just for them to look at energy as electricity, but to know that energy is more than just electricity. Once they also have an understanding, we know that they will be able to prioritize it and it will be sustainable in the long run. We are also trying to see if, with the involvement of the technical working group, drawing most of its membership even from the finance department within the county, we hope they'll also be able to allocate some budgets. Because what has been happening mostly in the past is that at the county level, most of the money allocation there is no budget allocation for the clean cooking subsector or sector. So how then do we encourage or train or prepare the counties so that they are also able to see that they get or lobby to get a funding or allocation for the clean cooking? Once they have the funding or the allocation, then it becomes very easy for the continuation.
For the private sector, the signal is equally clear. The opportunity is here. The market is ready. The only question is who will move first.
Come December 2026, end of this year, we shall have really impacted on these businesses in terms of widening their market share, helping them to be able to access capital, being investment ready, complying to standards, and a number of things. And all these are critical for these businesses to be able to become sustainable and also profitable in the long run.
And Dr. Kobai sees one further possibility, one with the potential to transform not just health outcomes, but the economic future of an entire county.
If we are able to translate or transition from use of non-clean energy to clean energy, or the clean cooking, and that will be a game changer in the county. Meru County will start benefiting from carbon credits after transitioning from the use of non-clean cooking to clean cooking.